Joel Embiid's knee issues seem to have not made any real progress in recent weeks to months, with new reports he's receiving regular injections in his knee, and even this article that just came out this past week about these radical procedures to try and address his issues. In this video, we're going to take another summary look at everything going on here, these radical operations, and where I think things might go next with Joel. Welcome back, everybody. I'm Dr. Brian Sutterer, and the goal in this channel is to teach you more about the medical side of the sports world. And we've talked a lot about Embiid's issues with his knee, but now that we seem to, I think, truly be at an inflection point here in terms of either a radical is not a crazy word to use. I'd argue some of the stuff that's commented on in this article is not radical or even practical to do, but we're definitely at an inflection point of making a big decision on, number one, is there anything major and salvageable that can be done for the knee, or is this something that you simply have to manage symptoms and manage pain? And we really are at that point, so let's talk about where those paths diverge. Now, we have to start with the basics. Looking at our biodigital anatomy tool here, let's understand some very just simple key concepts with the knee. We know that Joel has had a history of meniscus surgery, specifically surgery to trim out or remove part of the torn meniscus tissue in his knee, called a meniscectomy. We also know that he specifically has had meniscus tearing in surgery on the lateral or the outer meniscus. Let's hide our kneecap to get that out of the way. We don't really need to see that here in this instance, and we don't need to see our ligaments inside the joint. So there are two menisci. There's a lateral, which sits on the outer portion of the joint, and there's a medial, which sits on the inner portion. Some of these surgeries they're talking about in terms of these, cutting a bone to change his alignment, that all depends on which compartment is involved within the knee. So it matters, is this the lateral, is this the medial, or is this all three or two of the three compartments of the joint? Because some of this is venturing, I think, into the world of like arthritis, cartilage damage, and then it's especially important to know what part of the knee you're talking about. Now, why is the meniscus so important? This is a very simple concept. We think of the meniscus as a shock absorber, but it's also really important to stabilize the joint. When you have the meniscus in here, you have this entire curved surface of the meniscus that's working to distribute the weight and the forces through the knee all along that rounded condyle of the femur. If you completely took the meniscus out, then you are left with this curved surface on a flat edge, which makes this solid contact tangent point and increases your peak contact pressures and forces, which can then cause the force to be higher, more load on the cartilage, potentially more trauma to the cartilage, more chance of things like arthritis accelerating. So they talk about in this article that was put up here from Marcus Hayes about like mundane procedures, mundane injuries that Embiid has gone through in the past. There is nothing mundane about doing repeated or even single meniscus trimming and resections in a high level, large, repetitive, high impact athlete, because the more of that meniscus you take, the less it can do its job and the more stress and problems you can put on the rest of the joint. So if you take away anything from this video, just understand that and the value and the importance of the meniscus. Now we'll talk about what those downstream effects could be, what Embiid is potentially still dealing with, and those subsequent treatments. But first, I want to give a quick shout out to the sponsor of this video. Today's video is sponsored by Collar. Collar makes performance dress wear for men, and simply put, they're the most comfortable dress shirts and the only dress shirts that you'll see me wearing. I've been wearing Collar shirts for years now, and number one, I absolutely love the comfort. They have this nice athletic wear type of material that's actually made with recycled plastic bottles and is extremely lightweight and breathable and easy to move around and get about your day in. Their material is also wrinkle resistant and stain repellent, and so I've never honestly had to iron any of these shirts, and they always look fantastic just simply hanging them up to dry after a wash. Their lineup also features other fantastic products to round out your wardrobe. I've got some of their shoes, ties, they even have blazers, dress pants, everything you need to be comfortable and stylish with your dress wear. Their shirts are already extremely affordable, but right now Collar is going to hook you up even more by clicking the link in the description and using code Brian. You're going to get 15% off your purchase. Trust me when I tell you these shirts are unbelievably comfortable and the only thing that you're going to want to wear after you try them when it comes to dress wear. So thank you again to Collar for sponsoring this video, being a longtime supporter of my channel, and let's get back to our learning. So most likely what Embiid has been dealing with here, because of the repetitive swelling, the repetitive surgeries, the repetitive pain, is almost certainly joint pathology, problems within the joint. Now, whether or not that's the cartilage or that's continued tearing in the meniscus, that also influences what potential surgeries or treatments he might have. My concern with the repetitive swelling, the repetitive effusions he's getting, the injections that they're doing, is that this has evolved beyond just simple meniscus tearing to more extensive cartilage wear and trauma within the joint. When we're old, we think of having osteoarthritis, that age-related, a lot of different risk factors and things that contribute to it, but that age-related breakdown in the cartilage. But athletes can get this too, especially when you've had knee surgery and ACL surgery, repetitive injuries. Athletes can get early kind of post-traumatic or secondary arthritis changes in their joint that can affect them the same way it might affect your 80-year-old grandma, but your 80-year-old grandma is not trying to play high-level NBA basketball. So depending on what they're trying to treat and depending on the extent of what they're trying to treat influences the availability of these different treatment options. Now, to understand what some of those treatments might be, let's go briefly here to this article. So they talk about these potential options. Meniscus transplant, low-dose radiation therapy, or even the ominous-sounding osteotomy, in which doctors break a bone in the hip to realign the joint to relieve pressure. First of all, that is not at all what is done for an osteotomy for the knee. I suspect what they're talking about here is something called a high tibial osteotomy, because there's no osteotomy I'm aware of where you're going to do anything in the hip to change what's going on down in the knee. We'll talk about a high tibial osteotomy and when that might be done for somebody with knee arthritis, but this is a treatment for arthritis. This is not a treatment for meniscus tearing, and there are some very specific indications to do this. So this whole breaking a bone in the hip to realign the joint, like, this is not correct unless there's some future research developed thing that I'm just not aware of. The only osteotomies that are done for knee problems are done down at the knee itself. And if they're talking about anything up in his hip, that's completely beyond, I think, any reasonable scope here. The first thing, meniscus transplant. So if we go back to our anatomy model, let's say you're somebody who has extensive meniscus tearing, but the cartilage looks to be in relatively good shape. If the meniscus is essentially gone or no function to it, you can do a meniscus transplant. Now, again, there are a lot of indications for this. There's a lot of factors at play. It's not as simple as just call your doctor and ask for a meniscus transplant. But yes, depending on which meniscus, depending on the state of the rest of the joint, you can take a meniscus from a donor and transplant it into the joint to try and restore that load distributing, stabilizing function of the meniscus. Lonzo Ball underwent one of these. I'm not aware of any heavier big men undergoing one of these, especially in the NBA. So this would be a little bit of an unprecedented sort of thing. And honestly, would be one of these radical sort of last-ditch efforts to do. It would be a very long surgery, and that is what they would potentially consider with the meniscus transplant. There was also some mention about a microfracture. I don't see that specifically in this portion of the article, but let's talk about microfracture for a minute. So microfracture has gone a little bit out of favor. A microfracture was an older way of trying to treat cartilage damage in the joint. And specifically what they would do is they would go in and cause fracturing to the surface of the bone and the cartilage with the idea of trying to stimulate growth of new cartilage. The problem is that the cartilage that grew back was this fibrous cartilage that was not as strong and robust as the original hyaline articular cartilage. And so these tended to not do very well long term. Now, there still are times where microfracture is done, but it's not the sort of tried and true miracle thing we might be hoped it was 15 to 20 years ago. There are other cartilage transplant procedures that can be done. We saw Lonzo Ball underwent this, I believe. That is going to be done if there are high-grade focal areas where the cartilage is missing. You don't do a cartilage transplant in somebody who's got extensive joint-wide, compartment-wide, extensive cartilage loss. Somebody like your grandma with osteoarthritis. You're not doing a cartilage transplant in somebody like that. You are doing it in somebody who has maybe a focal, think of a pothole, where there's one area extensive where the cartilage is missing, but the rest of the cartilage looks good throughout the joint. That's the time when you might do a cartilage transplant. That is something that has a pretty clear indication. Like, you get imaging, you see a focal high-grade cartilage defect. It's a pretty easy thing to say, yep, let's go after that. And so I'm less inclined to think that that's what's going on with Embiid, because that seems like it would be a pretty obvious option to consider at this point if there was focal, again, specific areas of high-grade cartilage loss rather than diffuse cartilage wear like we see with, age elderly folks getting osteoarthritis. But potentially an option, again, in that whole transplant procedure. You can transplant cartilage for focal high-grade tears. You can transplant a meniscus. Both of those are going to be big, major surgeries that hopefully would restore more so a quality of life, and any return to a high-level, MVP-level NBA career would frankly be something I think unprecedented in the orthopedic sports medicine world because of Embiid's size and playing position, but not off the table under the right circumstances. Going back to some other things mentioned in here, this talk about high dose or low dose radiation therapy. Like, I've completed a sports medicine fellowship at Mayo Clinic. This is not like a real thing in the world of traditional sports medicine. This is like an alternative medicine kind of thing. And so whoever Marcus talked to get this source is definitely thinking more in like the alternative medicine realm, and not like tried and true literature proven ways of dealing with this type of stuff. So I don't really know. This to me is kind of out of nowhere. This low dose radiation therapy doesn't really seem to make much sense as being a heavy literature backed solution compared to some other things. It's also not really like radical. I mean, radiation therapy is not like that radical of a thing necessarily for what they're talking about. So I don't really know what to make of that. Now let's talk about this ominous sounding osteotomy. So an osteotomy is a medical procedure where the bone is essentially broke or modified to change its position and change its alignment. Osteotomies can be done anywhere in the body. An osteotomy is just a general term for removing or modifying the position of bone. You can do osteotomies everywhere. In the case of knee arthritis, what's most often done is something called an HTO, high tibial osteotomy. And they're done in patients who have isolated arthritis, so one compartment or the other, and they have alignment problems. So this picture, this alignment is pretty neutral. Some people who get significant osteoarthritis in the medial compartment of the knee will present with a very profound, what we call varus alignment, where their knee wants to go outward. That position puts more stress on the inner medial compartment of the knee, and so you can do a high tibial osteotomy where you go in here to the inner portion of the high portion of the tibia, and you try to correct or adjust the alignment to take pressure off the medial side, put more on the lateral side to offload that joint. If it's on the lateral side, you can do the opposite, and then that's people who have typically valgus deformity, where the knee is going to, sorry, I drew that wrong, valgus, where the knee is buckling inward, where you can try and correct it on the outer portion. Most of the time, this is done for medial inner compartment osteoarthritis, isolated medial compartment osteoarthritis in people who have alignment problems. So this isn't like let's just do an osteotomy type of thing. This is something that is only applicable to a very select percentage of people. Now, again, like I said, they talk about like a hip osteotomy. If we're talking about something all the way up at Embiid's hips, like that's completely getting into a totally different realm of what could be going on here. I'd be expecting Embiid to have hip problems. Like I don't see some simple osteotomy up at his hip necessarily being what they're talking about for the knee. I suspect they truly meant instead a high tibial or an HTO, high tibial osteotomy. If not, I'd love to be corrected on this and maybe learn something, because osteotomy up at the hip, like what's mentioned in this article, really honestly doesn't make much sense, and even like as a practical thing that we think about for knee problems. So all of this coming back together here, I think this is where Embiid is truly at a crossroads, because number one, you have to decide, are any of these interventions possible? Is he a candidate? Does he meet the indications to where practically it would make sense to even try them? In somebody who has extensive joint-wide diffuse arthritis and cartilage loss, these procedures are not things to consider. And so you are left with trying to manage it with injections, draining the knee, but that's all short-term symptom control. Nothing, despite whatever you read about these stem cells, people saying they should give them stem cells are not growing cartilage back. There's no evidence that stem cells are growing cartilage back in the joint, growing the meniscus back. They might help with pain and symptoms, but they're not changing the long-term structure of the joint. So that is really the decision point. Is the knee at a level where something can be done to try and fix it? Something radical at this point, like meniscus transplant, cartilage transplant, any of these other surgical interventions? Or is it so widespread and diffuse that there is not a single targeted intervention and he is just dealing with a lot of degenerative change in his knee? If it is that case where there's not a specific thing to do, then I don't see a long-term solution to this, because he's already been trying to rest. He's been trying to have all these injections available, and there's not some other magic pill that's going to fix it. I think he could potentially change the expectations, change minutes. You potentially can extend this a little bit, but it's not going to suddenly revert back to before. And yes, a repeat meniscus trim, a repeat meniscus surgery that's not a transplant might have some short-term benefit and get him by for another 3 to 6 months, but then we're going to be right back here at square one. So I think this is a critical point. This is unfortunate. It stinks. This is the stuff that can happen to these athletes and might be related to previous surgeries. And sometimes this stuff just happens regardless of what surgeries or activity you've done. But this is the decision point, I think, of are we going to see a drastic intervention to try and salvage some remaining years, or is there truly just nothing else that's reasonably on the table, and the only thing might be like a knee replacement, like a joint replacement surgery, which of course you're not going to then be back playing in the NBA, high impact repetitive career with something like that being done. So stay tuned. We'll see if we get any more updates. I'm sure certainly by the end of the weekend, we'll probably have heard something. I'll try and update things if we hear about the plan, but for now, hopefully this was educational. A little bit longer video, deeper dive, looking through all these different options and trying to make sense of what could be going on. Let me know, as always, any questions or comments down below. And until next time, we'll see you later.